can officially start. There. Good afternoon, fellow Rotarians. Welcome to the weekly meeting of the Rotary Club of Barrie. Things go better when you are here. Special welcome to any visiting Rotarians and our special guest. I do see Elaine there. See who else has come join us. Please come back again. Right now, if you could stand for our opening of our meeting. Beautiful. A toast to the Queen. Okay, we do have some guests. We do have a very special guest, which I'm going to introduce first, or Steve will.
President Deb, our guest today is grandson Ledger. And accompanying him is his mother, a fellow Rotarian, Lauren.
Hey, Lauren.
Wave. Okay. So, Baz, we have a guest?
I do, President Deb, fellow Rotarians. My guest today is our newest member, soon to be inducted, Taylor Curry.
Welcome, Taylor. Enjoy this. This might be your last time being introduced as a guest.
Thanks.
Any other guests? Visiting
President
Rotarians?
Debbie, we have Elaine St. Pierre, but she will be officially introduced as our speaker later. Hello, Elaine.
Welcome. So I hope you enjoy your time with us. Love having everybody. Our Beacon editor this week is Jason MacArthur, and many thanks to Adam Smith for a great Beacon last week. We do have a couple of announcements. Just before we get going, Dave, can we throw the quick poll up? So as everybody noticed, we had breakout rooms as everybody came in. Some feedback that came through on our board meeting this week was it'd be nice to be able to have a smaller group to chat as people come into the meeting. So we tried that. I see lots of people loved it, which is great. So we will try this again. And hopefully people come on a little sooner than 12:15, 12:10, so you can have some time to socialize and have a little fellowship. So thank you all. So announcements. Let's see. Let's start with Bob.
Hey, President Deb. Do we have a picture? The Festival of Trees Committee would like to give the Rotary Club of Barrie from the profits this year, 2021, $34,000. I wish to thank my committee who works hard inside and outside in good and bad weather. John Laking, Michael LeCollier, Paul Marley, Dave and Nancy McCulley. Nancy climbs the ladder while Dave holds it, and the weekend helpers for setup and takedown. Paul Marco and others for signage. And my sales staff this year was Brandon Elliott, Rory Quinn, Jeff Hand, Jonathan Derrick, Graham Mallory, and Jim Williams. We cannot do this project without the help, and we had a great year. Thanks for all those kids and families who help. Appreciate it.
Well, thank you, Bob. Dave McCullough.
Hi, President Deb. How are you? Can you hear me okay? No? There?
We can hear you fine, Dave.
You're good, Dave.
Okay, okay. Well,
Dave,
sorry. Am I on or not?
you are.
Okay, sorry, President Deb. First of all, I just noticed in the background that Ledger needed a diaper change and Steve disappeared.
Yeah.
And Lauren's looking after things. So I want to know how that program works. Anyways, just to save the date, please, SAA committee, golf day will be May 27th. And we will be returning to Innisbrook, located at 211 Lockhart Road. Always well maintained and a challenging design, and always well staffed to make everyone's experience a wonderful day. So please mark down your calendar for May 27th. More details to follow.
Great, thanks a lot. And yeah, everyone saw the picture. If we can just pop the picture back up for a sec.
Coming.
Yeah. So one of our fellow Rotary clubs in town, Campbell Rotary, is doing a car lottery. So they asked us to share it at their meeting. So you chance to win a BMW, which is pretty exciting. So, you know, it's nice to support our fellow Rotarians. And we also have a call for, we're still looking for the online marketplace. We need somebody to just help coordinate that. So if anybody out there would like to be a little bit more involved and help us out with that, would be greatly appreciated. Give Kaylee a call or connect to find out a little bit more information about it. Would be awesome. Thanks so much. And I'll give you the money. Okay, there we go. Okay, birthdays and anniversaries. We have no birthdays today. We do have a few anniversaries. Jessica Potvin and Rob Galloway is 4 years on March 18th. Tanya Sari and Mark Sari is 19 years. And Chris and Don Pratt is 48 years. Congratulations. And for date joined, John Ingram, 6 years. Dan Mallory is 40 years. John Laking is 25. And Sue Barnes is 9 years. So time flies when you're having fun. So being we don't have any birthdays, we don't get one of those awesome birthday songs. So hopefully next week we'll be able to make that up and get into those funny ones. I really enjoy them. But for your anniversary, a donation to Polio Plus and to the Rotary's efforts towards COVID-19 has been made in your name, and I hope you enjoy your day. Let's see, SAA Eric, we're right into you. We don't have our birthday song, so it's a little quicker.
All right, thanks, President Deb. And stand-in Secretary Dave, we'll go ahead and pull up a couple of slides for the SAA piece today. Which one did we start off with? I think we've got a little bit of news from the Barrie Chamber of Commerce. And I did see that both Paul and Todd are online. You guys have had a lot going on. I wanted to hear a little bit more about how things went with the women's panels last week, and give you a chance to promote the upcoming Barrie Chamber Business Awards. and see if there's anybody in the club that might have become a finalist that may want to make a good news announcement, because nobody has come forward to do that with me yet. So Paul and Todd, why don't you unmute and let us know what's going on?
Sure.
Paul, is there anybody we can hang?
President Dev, yeah, we've got a few people we can hang. We did our Women in Business Week was last week, and it's actually Women in Business Month that we're really looking at because we have a digital format. Very successful. Each of the events has generated a lot of activity on our social media. Gotten a lot of positive feedback with it, and we'll continue to do those things throughout the year. The next event that we have coming up is our Barrie Business Awards, which are on March 25th. We have our own Siva Creative has been nominated, I believe, in 2 categories, and our finalists in 2 categories, and also Barriston Law is involved there as well. So,
Fines.
what do you want to do with that, Eric?
That's those are pretty exciting pieces of the news. I see Jacqueline's online but muted, and I didn't check to see whether Mallory was with us today. It's funny that I haven't had any good news announcement requests from these folks.
Mallory,
Mallory.
Arif. Is Arif here anywhere?
I know there's bound to be some penalties for this.
Oh, they knew this was coming and they avoided the meeting.
Left the room apparently, so I don't know.
Yeah, there's no Siva Creative in today. No RF
Okay.
or Mallory.
SAA Eric, if they're not on side, would it be possible then to, of course, fine the president and the executive director, because they are heading up the program?
Like president of Rotary?
No, president of chamber.
I'm all for the president of the chamber taking a fine on President Deb. I think that's entirely appropriate.
I'm all in favor of president of Rotary accepting a fine. Yeah.
So it's a pretty exciting month. It's pretty neat to see what all's going on, and
Great
just
news
the
for Paul, Eric, and he'd be happy with a fine.
and it's nice to see the pivot to the virtual awards. What's that going to look like? Like, why should we be booking our time slots to come and see that?
What we've got going on, and you may have seen Todd and I demonstrating maybe an inappropriate action recently, which we've addressed.
It was not inappropriate.
From that.
I disagree.
There may or may not be a video including a large pickle suit coming up that will be slightly entertaining. Jody's shaking his head because he's already seen that act. But we basically have the business awards coming up on the 25th. We've taken a theatrical approach to beginning and engaged Ian Mogash as our host. Adam Smith, who has done a fantastic job over the years. He needs to focus on his business, and being virtual, this was going to take a lot of time. Ian has done a great job in getting us prepared. And the event actually has a live component. So it's not going to just be staring at a screen. There's going to be a bit of chance to network, but you're also going to see the awards given away live and a live response and Q&A with the winners. So we're excited to have that happen. It's going to be on March 25th at 7 p.m. We are working on a bit of a fashion show to explain what it is that you could or could not wear for that event, and different activities that you could do with our local restaurants to perhaps.
Fashion show, that's the word.
Yeah. So, you may see Todd in a dress. We don't know. We'll see. But ultimately, it's going to be a good night. I encourage everybody to come out and join us. If you can't, it's still going to be something you can watch after the fact on YouTube. And if you haven't already subscribed to the Barrie Chamber YouTube channel, please click and subscribe. So.
Absolutely. Big fine for Paul for self-promotions. Good job.
Absolutely. So,
President Deb, did you want Todd to pick us up some lottery tickets as part of his contribution to the club?
Whatever you want.
yeah, I think so. I think this is going to continue on. I think maybe some lotto tickets would be good.
You want Canadian, US, do you want Powerball? What do you want?
Well, the US might get a little too complicated. Let's stick with something in Ontario and go from there.
Okay. So in the usual format, I'll get a relatively fair amount. Anybody that's registered on this meeting today actually qualifies for their share of the win. You're not here, you don't win. See, now it's recorded. Now it's official.
Now it's official. Boy,
Let
I
it be
missed
written,
that,
so let
Todd.
it be done.
I will send those off to Mr. Porter later today for distribution.
No, I'm not the secretary. I'm just the Zoom host.
Yeah, now and then you come in a little bit handy, now and then.
Send it to Jeff.
All right, thanks, guys. President Deb, I did encourage the guys to give us a nice update today, because it's just nice to see business carrying on and getting some recognition. So thanks for the update, guys. Betty Ann, there's been some interesting stuff going on about your family growing on Facebook. Did you want to tell us what's going on with all of that?
President Deb, fellow Rotarians, we've had an exciting month. Our granddaughter gave us DNA tests for Christmas. And so we sent them away, and Doug's came back with a full sister. She's older than him, and we haven't been able to meet her yet, just on FaceTime. It's unbelievable. Her family has embraced it. Our family has embraced it. Doug's parents were young and were not married when she was born. And back in those days, I mean, we're older, a lot of children were given up for adoption. And so she was never spoken about. And so this is so exciting. She's been looking for years. One of his aunts kind of told me that this could be about 25 years ago. And Doug was afraid to upset. He didn't want to upset her, so he wouldn't let me look for her. And anyway, it's all worked out. It's unbelievable. We can't wait to get together. All the kids are so, you know, her children. And so they met for the first time on FaceTime, and the two of them are standing there, and Eric showed the picture. They both cried. And then it was total laughter, her asking questions. She didn't know why the last name on her birth certificate, where that came from. So there was just so much information, unbelievable. And then mine came back, which was boring, except I found out that the ring bearer in our wedding, was adopted. We knew he was adopted. And then his father died. And so my father-in-law married his widowed mother. He became Doug's stepbrother. He's my cousin. He's my cousin. And so, oh my gosh, so if you ever go to do it, don't be surprised what comes up. And people have been, cousins and all that, but it's beautiful. And so Doug is so happy. He's got an older sister, and she calls him her baby brother. So there, long story, exciting. There you go.
Pretty
That's
cool.
so sweet.
Dave, did you want to show us that picture again? It was a pretty neat picture of Doug and the new sister.
Sure, one sec.
This is them meeting for the first time on a Sunday morning. It's so neat. It is so neat.
That's really
Yeah,
cool.
that's pretty special.
Yeah, it was.
That's a big smile.
And we FaceTime all the time now, and it just is nothing but positives. So, and she lives in Niagara Falls. And so we've driven by there. That was part of our area for years. And so look out for folks. You never know who needs you either.
Now, President Deb, we've often fined folks for a new grandkid. It's sometimes related to the weight of the grandkid. Do you know what this person weighs, Betty Ed?
Never ask a lady how much she
I'll
weighs.
step in. You never ask a woman that.
It's worth a fine. I don't mind. I can send you $20.
Oh, I was going to go with 5, but
I'll go with 20. It's so good. It's positive.
That's
awesome.
such a sweet
Thanks so
story.
much.
Thanks, Betty Ann. That was a really fun one to hear about. Let's see, Dave, why don't we pull up this? I got one of these emails from Bob Greer. I think a number of you did. Bob, did you want to tell us what's going on with your accounts? I tend to think that if I got an email from you, it's probably not actually from you anyway. It's usually from your spouse. But you know, were you trolling for some help, trolling for some extra cash? What's going on with Bob?
No, we were, our email ended up being hacked, and unfortunately, Shelley was up with the grandkids, and she kind of screens all this stuff before it gets too far. And she wasn't around, and unfortunately clicked on the wrong email, and everything went out. So I did get about a phone calls from about 1:30 till 5 o'clock about every 5 minutes or less on the cell phone and on the landline. So it was a very busy afternoon. And on top of that, the day before, we had a power failure and our computer blew, and we lost the computer like in the morning of that hit. So beware, if someone asks you to update your Rogers Yahoo account, don't even consider it, because they get the emails from the Rogers account, and they don't get the emails out of your computer. They get them from the Rogers account. And so that's what happens. But on a good note, there was one lady that called me back, and she followed a scam before that she received before, and took it right down to the end and said, look, I'm an elderly grandmother and I got lots of money. Who do I give it to? And I said, well, I have to get you my supervisor. And so when the supervisor came on, she said, you know what? I've got all this money to give you, but I hope your grandmother gets hacked as well. So he threw it back in his face.
Nice.
And they still keep trying. They tried again this week again already.
Wow.
So
everybody else get an email from Bob as well, or did you feel left out by not getting a hack mail? Yeah, there's lots of lots of us out there.
So Eric, is that $1 an email to all of us?
It's you know, I think it's a kind of a what does Bob and Shelley think is fair for the amount of fear that we were worried about what was going on with Bob and why he needed so much help. Bas, did you end up sending him a bunch of money?
Bas gave me a phone call.
President Deb and SA Eric. I had already responded that sure, I'll help you out for how much. And then I didn't hear back from him because Rogers at that time had gotten smart, and there was a response to my suggestion I would help him out, but that had gone into my spam folder, I found out later. So Rogers was on to blocking the follow-ups. So I gave Bob a call as soon as I was done work. I said, Bob, how much do you need? He said, oh, it's a scam. So I said, okay, that's nice to know. I will not make any mistakes. And of course, ratted him out like crazy to SA Eric.
Yeah, it sounded kind of like Bas just offered to do the fine for Bob. He said he's willing to give him as much as he wants. It's
yeah, and Bob was going to pay it back according to his email. So I'd be happy to arrange that.
Well, probably with all the money Bob's collected, he has a lot to give us.
Yeah, I haven't. The only thing I've done is made Ian Pavlik a little more wealthier.
So Ian is going to pay the fine?
I think so. It's going to cost probably close to about $800 or more.
President Deb, I would be glad to. I'll just add it to his bill.
Okay, perfect.
Excellent. Well, one of you can toss us a little bit of cash into the accounts. Thanks, guys.
I'll take care of it.
Let's I think I saw, was Jody online today? Yes,
Jody is. Yeah.
Why don't we throw up that picture, Dave? Now, this isn't really an intended fine. I just thought that, you know, Jody could do a master class in product placement. He just has this habit of standing right beside product when he's online. Yeah, you know, Jody, did you want to describe what that particular product is? Because you're just becoming a real master at this game.
Hi, President Deb.
Look at it. There you go.
President Jody.
Hang on there. That's better. To answer your question, no, I don't want to. I have no idea what you're talking about, Eric. There's a Toronto Maple Leafs jersey in the picture, which I was fortunate enough to win, and a water cooler, but I don't know what else you're talking about.
It is, I think it's especially good how well the KIS logo shows up. That's a pretty nice logo that just pops off the screen right there.
It does look good. I'll give it that, but I probably don't have a huge defense here. I got nothing for you. I'll have to plead guilty and beg for mercy.
You know, it's almost like that machine is like a key part of any background, like of any operating business.
It's a really old machine. It's even older than the computer that Bob Greer was working on to have all his emails get compromised. And it does still work, so it saves me walking all the way out front.
Well, I do think as incoming president, I think you're off the hook there, Jody.
Yeah, we gotta be careful.
I guess I have to pay that forward for the next year for you, President Deb.
Well, yeah, this is being recorded.
I didn't say I agreed to that. I'm just saying that's what you're asking. Well, I guess we'll see how that goes. But that sounds like a fairly reasonable request.
Okay, we'll go with a good try.
That works. Thank you.
All right, we've got one more. I think only the one more that I'm going to do today. Just a little cartoon that was sent to me. I think it might have been Boss that sent this as well, or it might have been President Deb. Just in case as you go into your breakout rooms, I thought this was pretty nice. Just an example of good Rotary generosity of bringing donuts to the Zoom meeting. Okay, I've got a poll for you today, and this is going to lead you into to breakout rooms. This one is about vaccination and what your status is. So we've got a couple of different choices up there. So if you want to start voting in on what's your vaccination status, then we'll chat a little bit about vaccination experiences over the breakout time. I'm getting to watch these as they come in. A lot of very young Rotarians, clearly. This is good. And after that, we are going to go into breakouts. I think because of the topic and because we're relatively well along, maybe we'll do maybe 10 minutes, 11 minutes, Dave.
Sure.
And that looks good. Let's end polling and show the results. So there we go. We've only got a few of us that have actually already been vaccinated, some that are scheduled. A lot of us at that very, very young stage, and nobody is admitting to not wanting to get vaccinated. So that's good news as well for us as a club, because we want you all vaccinated. President Deb, any chime in on vaccination statuses?
I think everybody should get one. I know I'm trying to get one. Don't know when it will come, but I did see that Todd Armstrong was trying to get his cat in for vaccination there.
Is that true, Todd? Is that a COVID vaccination, or what are you working on?
He's just hanging around my feet annoying me, so I thought I'd show him what I was up to.
Yeah.
Nice.
Thought maybe you're trying to get him in for a vaccination there.
All right, let's break out into our breakouts. Dave, do you have the assignment that we could show, or I can find it on mine? So what was suggested is that two things you might want to do. One is you could talk a little bit about future breakout sessions. Tell us about things that you think would be kind of fun to talk about when when future meetings, and you can share your ideas in chat when you're back in the main group. And interested to hear your experiences with vaccination to date, or your experience in trying to get vaccinated or book one. See if anybody on your breakouts has been vaccinated yet. And Dave, do you want to launch us into breakout rooms? And you already have. All right, thanks, and we'll see you back in about 10 minutes.
You thought that was funny, David?
We're back.
Yeah.
All right, don't forget, if you had any ideas for other things you want to see on breakout rooms in the future, please do drop a chat note, and I will keep an eye on those. And I'm out, President Deb.
Awesome, thanks so much. Hope everyone enjoyed. We have everybody back? I think so. Okay.
Looks like it.
Okay, so this week's program, I'll have Baz introduce.
Thank you, President Debbie. It is my pleasure to introduce somebody whose organization has been taking my blood for many years. Elaine St. Pierre is the territory manager of the Canadian Blood Service. Simply put, she is responsible for filling the beds, so getting people like me to basically give blood across the whole region. She's here today to bring us an update of their operations and the impact that COVID has had on Canadians, on the Canadian blood supply. Without further ado, welcome Elaine St. Pierre.
Thank you very much. Baz, if I'll just let you let me know if you can see the main screen or if you're looking at my notes. I'm just trying to get a handle of what I'm looking at here.
We're seeing notes.
Okay, so that should be better,
That's
right?
main screen now.
Excellent. So thanks very much, everybody for having us here. I'm really enjoying, first of all, seeing and meeting new people and not the same, team members that I see every day on a Zoom call. I think it's wonderful how we've all adapted. And I'm really, very impressed with the way that you're running your Rotary meetings, which is fantastic. And that fines are still being paid even remotely. So I'm very happy to see that. I'm really here today just to give a little bit of an update and hoping that we can have a bit of a discussion even. I don't want to take up too much of your time, but I do want to start off, with a little question. So feel free to turn your mics on, shout out your answer. I really want to hear, what you're thinking here. So the question is, what % of Canadians do you think have needed or know somebody who's needed blood or blood products? Do you think it's 32% of Canadians, 42%, or maybe how many think it's 52% of Canadians?
Almost everyone's muted, so I don't think they're gonna be shouting anything out right now.
All right.
52%.
52. You know what? You guys are smart. We've done this before, haven't we? So it's true. Over half of Canadians are going to need blood or know somebody who needs blood or blood products at some point in their life. So I'm here today as Territory Manager for Canadian Blood Services, and I oversee our blood donor clinics in Simcoe, Muskoka, Dufferin, and Grey counties, as well as parts of Peel. So if anybody's looking for a nice used car with a lot of kilometers on it, you just let me know. My role focuses mainly on finding enough eligible blood donors to roll up their sleeves at our clinics so that we can all meet hospital demand. So what's that demand look like? Well, hospitals in Canada they actually go through about 16,000 units of blood every single week. And so we have to collect that every single week. Why? Because blood has a really, really short shelf life. I'm not going to lie, this is the hardest job I've ever had. And let me tell you why. It's because only 1 in 2 Canadians are eligible to donate blood. So it's all about finding the half of us that can donate and then convincing them it's a good idea and then making it convenient and accessible for them to do so. So today I want to fill you in on why the need is so great, as well as how we've adapted during COVID. And I'll be covering a lot of information in a very short period of time. And if you haven't figured out already, I do tend to speak quickly, which is not the same as speaking moistly, but it's so we can have a few questions, time for questions at the end of the call. So we're all missing out on those social connections. And while these Zoom meetings are great, it's really one of the reasons why I've come here today. Our Barrie Donor Center is used to surviving on what we call group donations, typically corporate groups or sometimes schools or service clubs like Rotary, any group really, where we pick a day and a time that's convenient for everybody, and we block off some appointments back to back in our clinic, specifically for you to come as a group where you can come together and share in that experience, give life, and get to laugh and point at each other across the room. But COVID-19 has derailed a lot of those groups, especially the corporate ones, because it's the members of those groups that are no longer in that same office. Instead, they're scattered all over the region as they work from home. But that doesn't change the need. Group donations are still possible. This is an elementary school, for example, in Beaton, and the staff there were regular group donors before the pandemic, and they've kept up the tradition donating together as a team right through all of last year, even when the schools were locked down and they were actually teaching remotely. They still came together. This is actually a picture from last June where they donated at the clinic in the Tottenham Community Center. And you can see it doesn't need to be 50 people to have a group donation. This type of small but regular support really helps us meet our daily needs for the hospitals. When I speak about the need for blood, it's really important to note that blood and blood products are part of everyday critical medical care. So we're talking surgeries, medical procedures, cancer treatments, managing blood diseases and disorders. And as a blood donor, you become that vital link in Canada's lifeline. You can help patients wake up healthier each day. Canadian Blood Services is that connection between the generosity of the blood donors and the heartfelt appreciation of the recipients of those products. But what you may not know is that we are more than just blood. In fact, we have 4 areas of focus. Donated plasma helps thousands of patients that require life-saving therapies and treatments that are made from plasma-derived protein products. Stem cells, specifically blood stem cells from adults, are immature cells that can develop into any cell present in the bloodstream. And stem cell transplants are a potentially life-saving treatment for many blood diseases. And our biggest challenge right now is the lack of diversity in the National Registry. We need more ethnically diverse registrants between the ages of 17 and 35 who are willing to sign up. We also work with the organ and tissue donation and transplantation community to develop practices, education, awareness, and reporting. And I will note that April is the National Organ and Tissue Donation Awareness Month, where we're encouraging all Canadians to make their intent known and make sure that they've got their driver's license there signed, knowing that we want to be an organ donor. The primary focus, though, of course, what we're going to talk about today is mainly blood and our blood donor clinic. So some of you might be wondering about what it's like to donate blood, or perhaps you've donated before and you're a regular, but maybe it's been a while and you're wondering how we've adapted to COVID. So like many organizations, there's been a lot of changes to what we do because of COVID. So let's talk about that. Because we're responsible for the safety of the national blood supply in all provinces except for Quebec, which has their own system, we really take that responsibility very seriously. And because safety is our highest priority, we do have enhanced wellness measures in effect throughout all of our donor centers. We're limiting the number of people in our sites. All the donors must have an appointment before they come. They must wear a surgical mask, which we will provide, and we do have to maintain that physical distancing in the clinic. So all these measures put new constraints on how much blood we can collect every single day. Ultimately, these measures protect our staff and donors, but it does mean that fewer people are donating each day. And that means fewer life-saving and life-changing donations for patients. So for that reason, we must ensure that every single appointment is filled every single day. We've also made changes to how our snacks and our drinks work. I don't want everyone to panic. We still are famous for our juice and cookies and lots of other yummy treats, but now donors enjoy a post-donation snack after they've left our building because we don't want anybody taking down that mask. We want them wearing it for the entire visits. So our snacks are more of a grab and go scenario and just like takeout that we've all become accustomed to. I will mention as a side note, if you are thinking about donating blood, ladies, as a piece of advice, bring your largest handbag, and gentlemen, 2 words, cargo pants, because we want you to be able to steal as many of those snacks as you can carry. Every donation makes a difference because, at the risk of repeating myself, blood donors are needed every day. Think about it. Even though we're all supposed to be staying home, there's still car accidents. There are still people fighting cancer. There are still mommies having complications during childbirth. All regular day activities that have nothing to do with a pandemic but could result in the need for blood. So let's move on really quickly to who can donate. This is super high level criteria for blood donation. There are certainly tons of more eligibility factors, and we do make a final determination when you're at the donor center, but these are the basics. So to be able to donate blood in Canada, you must not have had a tattoo or a piercing in the last 3 months. You must not have been pregnant or had a baby in the last 6 months. You can't be under 17, and you must not have lived in certain countries during certain years. You have to weigh more than 110 pounds or 50 kilograms. You must not have had a dental cleaning or filling in the last 24 hours or dental surgery in the last 72. In terms of travel, you can check the list on blood.ca or give us a call, 1-888-2-DONATE. Really exciting news. There have been updates to our travel deferral policy, reducing the time limit that you must wait after travel to a malaria risk zone, which is really exciting. So please do check that out. And as well, of course, there are certain restrictions in place now because of COVID-19. This may be very interesting to some as well. There's also an acceptable prescription list on our medication, of all medications on our website there, where you can find out if medication that you're taking is acceptable for blood donation. And it's sort of the top 40, if you will, of commonly prescribed medications that most Canadians take and whether they're acceptable or not. And again, you can learn all about that eligibility at blood.ca. There's even a really cool quiz that you can take. A few things to know to make sure you're reminded of before you try to donate. You do have to have that appointment. We don't take walk-ins anymore. You'll be required to complete a health questionnaire every single donation, and of course all that wellness screening that we're very much accustomed to now. You do need government ID of some sort, driver's license, health card, or your Canadian Blood Services donor card if you have one. And really prepare your body by having a salty snack and a great big glass of water before you come in for your appointment. Water is the key to a great successful donation. So now that you know a bit more about our processes, I'm sure you want to know why I'm telling you all this and why I asked to be invited here today. I don't charge a fee for being a guest speaker, but I am looking for something in return, and you might have guessed what it is. I want your blood. And if we can get either 5, 6, even 10 people to join us in saving lives, it could mean a lifetime to a patient in need. Historically, the months of January and February were used for the Rotary Challenge in Barrie. And if I'm not mistaken, it was actually usually neck and neck and down to the wire. And it was usually the Rotaract Club that often kind of came out on top. And kudos to them. They have still managed to donate 70 plus units of blood in 2020, right through the pandemic. So the bar has been set, and I certainly want you to join in. If we can pick a date, maybe a Tuesday or Thursday evening where we're open at our clinic in Barrie from 3 to 7, or a Saturday morning when we're open up until noon, sometime in April even, that would really help us out and perhaps pave the way for an inter-club challenge, sort of like you're seeing here. This is just a couple of examples from other parts of Ontario. On the right, there's a challenge going on in January in the Cambridge Rotary Club. On the left, there was a group actually of 20 Rotarians that were in our clinic in St. Catharines yesterday, and they were all geared up for St. Patrick's Day. So you can see too, social media is really a super easy way to get the word out for something like this. Booking an individual appointment is just as easy. You can do that online at blood.ca or download the Give Blood app to your phone. You can always give us a call at 1-888-2DONATE. I'll mention also, we've just recently launched a really cool team portal on our app and through your online account where clubs or teams can track donations made by their members. Groups are really loving it that we're seeing. They're getting lots of wonderful feedback, and it's really a great way to show progress towards a common goal. And of course, we want you to share your experience because we know that it's going to inspire others. It's the one thing that we've learned, throughout the course of the pandemic, that shift to social media and going there for their information. And so we really want you to brag about it. Facebook, Twitter, Instagram are all great for that. Canadians are generally a humble bunch, and we don't really like to brag about our accomplishments, but we really want you to boast about being a blood donor because we know studies have shown that it inspires others. These are our regional social media accounts here in Barrie, Blood Donors of the North on Instagram, and Lifeline Barrie on Twitter. Anytime that you can like and reshare our messages, you are helping us expand our reach. So please do that. So on your screen right now, you're going to see a number of reasons why people have chosen to donate blood. And just as I wrap up here, I want you to take a look at that very last reason number 43, because someone asked. Today, right now, I'm asking for your support. I'm asking you to join Canada's Lifeline. So help us by booking that group donation or an individual appointment, and then spread the word to your network. Remember, only 1 in 2 Canadians are eligible. So if that's you, we need you. Thank you so much, everyone, for your time and attention. I'll stop talking now, and I'll turn it back over to the group and be able to answer any questions if you have any.
Wonderful. Thank you so much, Elaine. Now, I did see Greg, you had a question?
Oh, I was wondering about eligibility in terms of the COVID-19 vaccine. How long after do you have to wait?
That's a great question. And also with all vaccines. So when we think of things like travel for Twinrex or hepatitis and things like that, there is a list on our website in the eligibility section. But I will tell you, very happy to announce that all the COVID vaccines that are approved, there is no deferral period. So you could have your COVID vaccine today and you can donate blood with us effectively tomorrow.
Thank you.
Great question. Thanks for bringing that up.
Do we have any other questions? Ken? Now you're on mute, Ken. Oh, Ken, you have to take yourself off mute. There you go.
How much protection do you get if you do donate blood after getting the vaccine? Does it give the recipient protection against COVID?
That is a medical question that's probably beyond my area of expertise. It's a very interesting one. Does the vaccine go through you to the recipient of the blood? I would assume not, but I've always said I'm about 8 years shy of my medical degree. So any specific, health related questions like that, I'm probably not the best person to ask. Go to those experts that are on the phone with us at blood.ca and our 1-888-2 donate.
Okay, thank you.
Awesome. And Peter, you have a question.
I have a question, just a plug. I don't know whether the club realized it, but I think Ron Dennis has contributed in excess of 200 times in his lifetime.
Ooh, that's fantastic. A milestone donor. I love it. Any other milestones? I know there's a lot of regular donors and, just kind of going around the call there. There's people I recognize from being in the clinic in the past as well. So that's an excellent thing to bring up. And we do love our milestone donors. I will mention Barrie does have a higher donation frequency than the national average, which means there are a lot of dedicated blood donors in Barrie. So that's a fantastic thing to know.
My son, who lives in Huntsville, has donated many, many times.
That's awesome. Also my territory, so perfect.
Good. You've maybe seen him there if you have been in the clinic.
Excellent, excellent.
And Peter Lormer.
How often can you donate blood?
So it's different for men and women. It used to be that everybody could donate blood every 2 months, or every 56 days or 8 weeks. A number of about 2 or 3 years ago, they made a change for the ladies because of our fluctuating iron levels, and they've stretched us out. So we now have to wait 3 months. And that's an interesting situation because when we, outside of Barrie, for example, when we go into communities like Huntsville, we were planning those donation events on regular intervals so that we'd be back in the community when they were eligible again. And we were doing that on a 2-month basis. So when they changed the eligibility for the ladies and stretched them out, we knew that on often occasions, they wouldn't be able to join us. And so we knew we would have to sort of replace those females with other donors to help fill up the clinic. But what we didn't expect to happen and what did is that when she couldn't donate, he wouldn't, because she was usually the one saying, come on, Harold, get the keys, we're going to the blood donor clinic. So we actually lost out on a lot of men too. So it's a good question to get out there too. We need those guys to keep up with their schedule as well. And maybe their wives join them less often throughout the year, but we still need them on a regular basis.
Thank you. And I can't believe you didn't realize that the guys wouldn't go if the women weren't forcing them to go.
And it's different in each community. There are some where it doesn't matter, but in a lot of my territory, a lot of the rural communities, it's a date night, if you will, or it's a chance to go visit with neighbors at the clinic. And that's kind of, gone a little bit as well. If anybody's donated, especially outside of Barrie, when we do sort of bomb into town at the community center or complex and that sort of thing, we used to, pack them in like lemmings and you're standing shoulder to shoulder with 100 of your neighbors. That's no longer the case. We've really had to spread things out. And as a result, we collect less blood when we come to town. So, but yes, it's part of the human psyche. We certainly learned that the women are the more altruistic sex in general, and they're the ones dragging their husbands.
Thank you.
Do you have any other questions? Well, at this point, I'll call on Todd.
Thank you, President Deb. And Elaine, it's great to hear your presentation today. Can you guys hear me?
Yep,
we can.
Okay, good. My microphone is a little bit iffy. When Bas started the introduction there, I wasn't sure when he said somebody who's been taking his blood for years, I wasn't sure if he was talking about someone from CRA or you. I'm glad it was you. In any case, I learned something from you today, a few things actually. I didn't know that only 1 in 2 of us are eligible donors. So I'm fortunate that I am one of the eligible donors. And I also liked your reasons for donating, and reason 43 was the reason that I resumed donating again. When I saw you there, when Dan Roberts was put his granddaughter's face to it and sent, he's a guy I play baseball with, and he sent an email out to all of us on the team with a picture of him holding his beautiful little bald-headed granddaughter who's going through leukemia treatments and requires platelets very frequently. And so that tugged on my heartstrings and got me donating again. And I shared with you the story of my first donation, which was also an early one. I've matured since then. In any case, so back to reason 43, since you've asked again today, I will get back in there and donate again. I see Eric Dean put up a notice that he's going on April 21st. Maybe I'll join you there, Eric, on the 21st, and we can share a pint in a different way than we normally do. I guess
I would not generally suggest having the pint after you've donated a pint.
Well, when I shared you the story about when I was in university, when I first donated, that was one of the reasons we would do it. We'd donate a pint of blood and then go to the tavern, and things happen quicker. So
that's right. In fact, ages ago, we used to partner actually with the pubs on campus, and they would give us chits to hand out for a beer after a blood donation. And many people of a certain age, that's why they started donating blood in university, because they used to get a free beer. So
brilliant idea.
Somebody said that wasn't politically correct anymore, and we had to stop that along the way. But
yeah, see, we all mature as we go. Yeah,
that's right. Everybody has a reason.
That picture you showed of those people who got together on St. Patrick's Day to donate, I wonder what they were up to afterwards.
Yeah, exactly. And there were 20 of them in our clinic yesterday in St. Catharines, so that was fantastic.
So on behalf of the club, Elaine, it's my great pleasure to thank you for your presentation today. And your message is a good one, and thanks for bringing it all to us.
I thank you for having us, and please, share with your friends. We're happy to do this in a corporate setting as well. Other, Rotary clubs, please share the message. We want to get out there to as many as we can. We've all been able to pivot to this virtual environment, and I'll speak for as long as anybody will let me. So I've not met a virtual camera that I didn't like. So very happy to come, and happy to come back anytime.
Thank you. Thank you.
Thank you, Elaine. I'd like to add the thanks, and we do have a certificate here.
Yay!
Appreciation of you coming to join us. In following Rotary, we are this close to ending polio worldwide. So 10 polio plus vaccinations have been made in your name, as well as Rotary took on very early our resource center to help with the COVID-19 and the fight against. So a contribution towards that has also been made in your name. So again, thank you so much for coming out and taking your time and sharing that life-saving information for us.
I appreciate the time. I will drop off the call. If anybody wants me, my details are up there on the screen. And I do wish you all the best. You guys are a great club, and really happy to see how you've pivoted in COVID, and best of health, and stay safe, everybody.
Thanks so much. Yep. We just have a little video to go on to.
Cool.
So President Deb's Stronger Together, Together Inspired moment. Of course, we've been dealing with Zoom, so having to do it still online. We have a little video to share for a together moment.
Right, guys, thanks for joining us. Just keen to have a chat about where we are, the situation at the moment. I think you're both there. Olive, hi, thanks for joining us. Mabel, you are connected, but you need to start your video. It's down at the bottom of the screen, a little, it's a camera. It looks like a biscuit. If you just nudge it with your nose, you should, there we are. You don't have to be so close if you want to move back a bit. All right, thanks. Right, so basically an update as to where we are. I can see you both look worried, but the good news from head office is that neither of you is going to be furloughed, but we have to try and repay that loyalty with some of our own. I know that's supposed to be a strength of yours. So what we're looking for, what management are looking for, are ideas. Sorry, Mabel. this is one of the things that we have to address, the lack of focus at times, because well, there's the inappropriate stuff with Kevin the Doberman from accounts as well, but one thing at a time. So there are things that we have to try and improve on. Well, I'm uncomfortable with the chat as well, but maybe you switched off the camera again. Can you switch it back on? You switch the video? Right, there we are. Okay, the annual report. You've pretty much ruined the sofas. 913 squirrels chased, none caught, so not a good return. So again, things to... Sorry, Mabel, if you're going to do that, could you just switch off the video function again so we don't have to see it? Right, while Mabel's away, Olive, good news, you will be receiving a small bonus for slightly better behaviour. Okay, Mabel, we'll have a chat in a minute. I'm going to put you on mute so I can talk to Olive. Right, Olive, I've got a message from management, which I have to read out. You're a good dog. Yes, you are. Who's a good dog? You're a good dog. I'm glad it makes you happy. Okay, will you just keep up the good work, and thanks for joining us. I'll see you on a walk. Right, Mabel, so if you could just take a bit of an example from Olive and follow her lead. Are you falling asleep while we're having this chat? This is all part of the problem that we've got to sort. She's gone. She's gone. Unbelievable. We should sack her. We should definitely sack her. She didn't get such good results.
Hope everybody enjoyed. That is Andrew Cotter. He is a sports commentator, Scottish sports commentator, and of course he lost his job when COVID hit, and he started doing this commentation to his dogs. They're hilarious, and I thought a Zoom one for a Zoom day would be perfect. So, having no other business. For having no other Rotary business, I declare this meeting adjourned, and everyone have a great day.